Children with autism are very unique. Almost every child is a little bit different. In fact, there's a saying we have in the autism field that if you've seen one child with autism, you've seen just one child with autism.
It's referred to the autism spectrum because there's very different presentations of these symptoms and how severe they are. Magnetic resonance spectroscopy, or MRS, is a type of MRI technique. So MRI utilizes magnetic fields to look at mainly certain tissue compositions in the brain.
It would really be helpful if we could identify who's going to respond, and this may provide us that opportunity, doing a scan that reveals the excitatory glutamate and the inhibitory GABA. And I thought, wouldn't it really be outstanding if we could identify who is most likely to respond? And this technique may actually help us do that.
The brain is made up of many different regions that communicate with one another to carry out different processing tasks. Research has shown that the cerebellum is involved in autism, specifically the balance of excitatory and inhibitory signaling. We wish to take a more in-depth look at how changes in the cerebellum are associated with connections in the brain, and why this is important in the study of autism spectrum disorders. Individuals with autism spectrum disorders consistently show changes in the balance of glutamate and GABA, especially decreases to GABA signaling in the cerebellum. Due to the connections of the cerebellum with other regions of the brain, changes to the balance of GABA and glutamate in the cerebellum could affect the balance of excitation to inhibition in other regions of the brain, leading to changes in cognitive processing, such as the processing of social or language information. Utilizing a combination of the techniques will allow us to determine the interactions between glutamate and GABA changes in the cerebellum on functional communication and structural connections with other regions of the brain. Relating glutamate and GABA changes in the cerebellum to connectivity in the brain with symptom presentation will help inform doctors of the potential underlying mechanisms of autism spectrum disorders, and this will be important for improving diagnosis and treatment.
A lot of these little guys really struggle with hurting themselves or can't sit still in order to focus on their classwork. Research is very, very important because it's only through that we're able to develop new things that can be applicable to children and families all across the United States and across the world. Parents are our number one supporters. They're their child's number one advocate and science number one supporters. So parents are so passionate about finding a cure for autism, but also finding help for autism. So many of them are willing to dig in, get dirty, get excited, get ready to help. All of us really make a difference for children with autism, whether that be finding a cure, whether that be finding solutions, whatever that case may be. Parents are dedicated to making that difference, and we are so grateful for their support, and it's so important that they be on board so that we can keep making a difference for children for years to come.
So when Sam was diagnosed, my biggest issue was the unknown, not knowing what was going to happen. I think I can speak for the majority of parents in saying that research certainly gives us hope. It gives us something to look forward to because we can see that there are actually positive results coming out of a certain therapy or a certain treatment.